Hello, how is everyone? I hope, let me just turn the sound up. Welcome to Wednesday. How is everyone? How's everyone going? Hope you're all well. I've just had to stick my phone on with gaffer tape, so I think gaffer tape's good for everything. Because my phone kept falling off, so hopefully it'll stay on, so that's good. So this is pretty exciting. So what I've decided to do is I just got so much great feedback from my last Facebook Lives that I thought, oh, it's just such a great way to connect with you all, and actually it's a great way for me as well to be able to just hi Florentina, how are you? How's it going? Thanks for joining. But these Facebook Lives are a great way of me to find out also what's important to you guys, also what's going on with you and other ways I can help. But it's also good for me because it means that I've got to kind of try and, it's good for me to recall what I'm going to say, and it helps me to kind of connect the dots as well and figure out what's going on. And that's all it is when it comes to kind of, health and well-being. That's what it's about. It's about connecting the dots and just seeing where things are related. So that's where it's really cool. And so what I'm doing is I'm actually going to bring these back. Instead of doing them daily and every day, I'm going to do them every Tuesday, Wednesday, Thursday and Saturday, so 4 days a week. But in today's is a massive topic. It's kind of this topic that's a bit scary. If you look at that over here, we've got the Krebs cycle, we've got all these different cycles here. This is methylation. This is a really, hi Lisa, how are you going? This is a massive topic. And this, I literally just finished up a meeting with someone, a rep from Medlab, which is a supplement company, and we were talking about fatty liver, and it's just amazing the things that you talk about. So fatty liver shows that it has high ammonia. Ammonia is in this methylation cycle. So then of course my brain starts just ping, 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 ping. I'm thinking fatty liver, methylation, MTHFR, and you just start connecting all these dots. I know, Lisa, this is just crazy. So this is methylation. So everyone, methylation is so important. It's how our body detoxifies. It's how our body protects its cells. It's our DNA turnover. It's our body's messengers. It's like a chain reaction. Hi Rachel. It's absolutely, it's so important, and yet it's actually been kind of neglected. Now I'm going to be talking about one particular part today, and it's just this tiny part here. MTHFR. Can you see there's so much else going on? But this tiny part here, MTHFR, which is, let me just say, because I never say it actually, MTHFR, which is methylene tetrahydrofolate reductase. So it is how our body utilizes B9, folate, folic acid. You may have seen it, it's so important with pregnancy, it's so important with fertility, it's so important with mental health, anti-cancer, cell turnover, DNA regeneration. It's really vitally important. So I'm just going to touch on that today. It's actually a really exciting topic because sometimes it can be the answer to so many chronic, long-standing health problems. So this is the MTHFR, the methylene tetrahydrate reductase, I remember, is the folic acid pathway. So basically what our body does is we eat folic acid in our vegetables, mainly leafy green vegetables, leafy greeny vegetables, that's how I normally say it, and that's not quite right, but leafy greeny vegetables. And what our body does is it breaks down that folic acid into a usable form. So our body can use it for DNA, our body can use it for egg production, sperm production, to protect our babies from other syndromes like spina bifida. It protects us from cancer, it protects us from aging. So it's so many things are going on. The first signs I notice of an issue with this folic acid pathway, the MTHFR, the first signs start early on. They can start in the womb. The first signs can be growth of tissue, an issue with tissue, and an issue with how the body is shaped. So we could look at maybe ears, the face is a little bit wonky, or there's spina bifida, or there's scoliosis, or there's a change in some kind of bony structure. Marfan syndrome, which I actually did a bit of research and I found that online yesterday. Marfan syndrome, which is where the chest goes inwards, a concave chest, that can even be a sign of a methylation issue, and we're talking about MTHFR. So any changes in the structure, any changes in bony tissue, soft tissue, any of that kind of thing, you know, a cleft palate, when baby starts off like that, that can be a sign of a methylation issue. So that's one of the first signs. Then there doesn't have to be a physical sign. The signs can then go on to what I found. This is what I found. Anecdotal evidence is what I found in clinic, and then doing a bit of research. Behavioural problems in children, sensitivities to food, ADHD, autism, and then fussiness, fussy eaters. Then that kind of goes into later in life. So people with bulimia, people with anorexia, that's how the kind of the chain of events goes. So you can see these subtle signs when you're younger, how it can move through, how it can kind of move through your life. So, you know, any teenagers with anorexia or bulimia, it's great to look at those things. Anorexia particularly, I would look at the zinc levels. Normally low zinc levels leads to anorexia. But it has been shown that MTHFR, so B9 deficiency, folic acid deficiency, folate deficiency, or your body not being able to convert it, can actually lead to bulimia. So just those little signs. So those are the signs that I see. Then we've got what influences it. So things that influence it. So there can be your hereditary position. So if your parents have it, so maybe if you're a woman and you've had very heavy painful periods, anxiety, depression all your life, you've had recurrent miscarriages, or you're unable to get pregnant, anxiety through your family, heart disease has been something that's been through your family, issues with your venous health. It's always then good to have a think about that, particularly if you're trying to conceive or you've got young children. Have a think about your health and how it might relate to your children and to their genes and their genetics and their DNA. Now, in terms of these genetic issues that we see on this methylation, if there is what's called like a SNP, or if there's a chain in the DNA, the sequence, for MTHFR, it's a change. There's two SNPs. They can be heterozygous or homozygous. Heterozygous is where it's from one parent, and it shows that about 30%, around 30%, can actually then experience symptoms. Just because you have this sort of DNA sequence, this issue with the MTHFR, it doesn't mean you're going to have symptoms. You're only going to have symptoms if your environment, you know, you've got heavy metals, you're extremely stressed, you're on medications, you're getting older, you've had a particularly bad diet all your life with high gluten, high dairy, high sugar, you may be alcoholic or heavy alcohol drinker, or you're exposed to lots of BPA. BPA in plastics has also been shown to affect this. So it won't necessarily show as an issue unless you've got the right environment to actually then trigger that gene. Then we've got homozygous. Homozygous is 2 copies, comes from mum, comes from dad, and that's around 60% it can express itself. So definitely if you're homozygous, or you know you've got parents with MTHFR, it might be something to consider treating it or getting tested. Now, I didn't know this, but I only heard this a couple of days ago. If you've got a parent with methylation defect, or they've got MTHFR, then you can actually get the test on, you should be able to get the test on Medicare, but that's only if you've got parents that you know have it. So if you're a mum and a dad and you've got it, you might be able to test your kids and get that put on Medicare. And if you know you've got a parent, you can test your kids. So it's worth doing because it does need to be treated and it can lead to long-term chronic health issues. So you're homozygous, Lisa. So Lisa's homozygous, so that means she's got a 60% chance of it expressing. But then there's a chance that her kids will be heterozygous, and so it's really important for Lisa to actually look at how to prevent it expressing in her children. So Lisa would look at just are they exposed to heavy metals? Are they eating good quality food? Are they taking particular nutrients? And we will talk about that in a minute. So as I talked about, the methylation is how we transfer groups, so carbon groups are transferred between each other, and it turns genes on and off, and this is this whole process here. So if one daughter is hetero, then that's, yeah, where it's come down from mama, unfortunately. But it doesn't mean that there's nothing we can do, and it doesn't always express. There's not always going to be, the genes might be fine, they might be stable, so we can't assume she's going to, the gene will express itself in that manner, but preventing it is very, very important. So we could be fine all of our lives, and this is why sometimes people get sick when they're a bit older. We could be fine into our 50s, our 60s, our 70s, and then we have a stressful experience, or we're exposed to heavy metals, or we're exposed to some kind of external influence, or we're malnourished because of a particular reason, and then the gene will express itself. So just because you haven't had any symptoms, you know, for the first 50 years of your life, it doesn't mean that you're going to be home free. You've just got to continue to care for yourself. Oh, that's great, Lisa. Yeah, it's good that they're testing and that it's rebatable as well. That's fantastic. So if we look at the functions of methylation, we can see where it might fall short if we are diagnosed with MTHFR. So it repairs DNA, so you're more likely to have insufficient. Think of where DNA really replicates fast, really replicates fast. We've got sperm and we've got eggs. So if you've got any of these methylating issues, you're going to have problems with your sperm and your eggs. Either the quality, either the numbers. With sperm, you might have issues with their motility, their mobility, the shape, the quality, all of those kind of things. They reduce aging. So if you've got an issue with methylation, you're going to be aging faster. The wrinkles, your body might be getting more aches and pains, arthritic problems, that kind of thing. So it's good to think about that. Telomeres are a huge thing, and I've done a bit of research, but I'm not down-packed on telomeres. But it's something that I'm going to be probably looking into 2017. I'm going to be doing a lot more research into telomeres. But the DNA obviously protects the telomeres. The longer the telomere is, the healthier you are. Some of us are genetically predisposed to have shorter telomeres, and we will age quicker. Hence why sometimes we see someone in their 70s or 80s and we think, whoa, they look so healthy. It is their lifestyle, but also genetically they're predisposed to that. So if they have their lifestyle to support their genes, to support their long telomeres, then they're home free. The gene is expressing itself in anxiety, central tremors, muscle scoliosis, and kyphosis. Thank you for that, Lisa. That's really, really helpful. Definitely grey hair in the methylation, you know, I found it. And, you know, maybe there's something there when we go through stress, it's actually affecting our methylation. I know back at the end of 2014, I went through a particular amount of stress, just through pushing myself, not looking after myself. And it actually was a catalyst for a few aging issues in my body. One being grey hair, and I shouldn't be getting grey hair because none of my grandparents had grey hair. My parents don't have grey hair. My dad does, he's 80, turning 80 in January, so congrats Dad, but he's not totally grey. My mum's still jet black, and she's 75, and my brother is as well. So it's, for me, that stress, I have a feeling that the stress does express the does halt the methylation, and it causes some issues with DNA there. It prevents cell damage. So maybe this is a thing with cancer. You know, all these things going on. Cancer seems to be rife, it seems to be growing, there's an issue going on. Is there an issue with methylation? Is that really the crux of it? Maybe if we dealt with methylation, and the reason I'm saying maybe is because the research is halfway there, and there's things to consider. So maybe if cancer is in the family, or if you're high risk cancer, or it's something you're concerned about, look at the methylation, look at your methylation pathways, particularly MTHFR, to make sure that what your body is doing is turning over damaged cells. Cancer is damaged cells, our body wants to go and clean it up, and methylation will help it clean up. So that's a really interesting thing to think about. Glutathione is a feel-good antioxidant. It's very important in our body. It makes us calm, it detoxifies us. It's so important. With methylation, it's going to be low. So anybody that suffers from depression along with stomach problems, you know, that's something to think about. Methylation supports the liver, and this is what I was talking about this morning. I was talking about how I've noticed that fatty liver is just such a thing at the moment. So many people are coming to me with fatty liver. I'm seeing women with fatty liver symptoms, you know, distended stomach, pain, maybe a bit of constipation. Fatty liver is something that just over the last couple of months I've noticed that it's grown some traction. So what's going on? Is it diet? Is it too much fructose, too much alcohol, too much sugar, or is something else going on? So fatty liver coupled with cholesterol issues, we're looking at methylation. So one of the things that happens in methylation, and you'll see it, Lisa, you would have seen it because you looked at this, is we get elevated ammonia. Elevated ammonia is this, it also happens in fatty liver disease. So maybe essentially there's also a methylation issue going on. So if you suffer from fatty liver, or you've got a family history of fatty liver, you know, thinking about your MTHFR and methylation is very, very important to do. Here's my topic, hormones. So if you've got a history of heavy, painful periods, polycystic ovarian syndrome, endometriosis, and you've been working so hard at kind of clearing all that and sorting that out, it's important to look at the methylation, because when we don't methylate properly, when we've got an issue with the whole methylation cycle, our liver's inability to clear estrogen from our body is decreased. So those kind of issues with endometriosis, heavy painful periods to look at, and also if you suffer from painful breast lumps, or your family history of breast cancer, ovarian cancer, endometrial cancer, then I'd really advise you to have a look at the MTHFR and get tested as well, because it's really important. That could prevent it, so it's really important. Weight loss. So weight loss is one big thing. You might be doing everything else right, but you're just not losing weight. If your cycle, if the methylation is slowed down, you're not going to lose the weight at the rate that somebody else will if they're methylating correctly. So it's important to look at that, important to look at the whole methylation cycle as well when there's any stubborn weight issues. You know, immune function, your stress response, neurotransmitters. So if you're not methylating properly, you might be anxious, you might be wired but tired, running on empty, you know, really, really hyper, or you might be super, super, super tired, one or the other. So definitely look at that one. And then another one of my favorites, this is a big one because this has been coming to me a lot, histamine. If you're not methylating correctly, you will have problems with histamine. Hives, rashes, itchy skin, sneezing, itchy eyes, just lots of itchiness because the body's not able to clear the histamine. So those are the main things that are really important for you to consider, and also just a couple of other things. Lisa, I know you've seen this diagram, but we're not just looking at the MTHFR, we're looking at all the other processes around, so all the other processes which are really important. So we've got ammonia. If your MTHFR and that cycle isn't working, your ammonia is going to be up. And we've talked about high ammonia can cause all sorts of, when it gets too high, it's very dangerous. Okay, so if you've got low histamine, what test did you do, Florentina? If you've got low histamine, your body actually you may be MTHFR, but you may well be a slow methylator. So you might have to be careful with some things. And then maybe the allergies wouldn't then, histamine balances out the allergy system. So you do need a bit of histamine. So you might need something. I'm actually having a look at the histamine here to see. It could be something to do with the purine, the purines, but definitely you're probably a slow methylator. So you actually need to look at things maybe to speed up your methylation process a little bit. So I would definitely have a look at that. Histamine is one of them. Ammonia is another, so fatty liver disease. But also another is urea. And looking at gout as well. So people that suffer with gout, people that drink red wine or wine and get awful cramps at night, you want to look at your methylation cycle. Okay, so do you react, Florentina, at all when you take activated B9? So it's the methyl B9, the methylfolate, or any other. Do you react to any of those? I'd be interested to figure out if you do react at all, because maybe you do. So gout is something that's very prevalent. Also, if you look at another down here just below the MTHFR, we've got MAO, COMT, DAO, and they actually regulate your serotonin and your dopamine. So anyone that's got any issues with MTHFR or methylation issues might suffer from depression, low serotonin, problems with serotonin uptake, too much uptake. So we need to look at that. One last thing looking at this is problems with glutamate and GABA. Now GABA is inhibitory, so that's why a lot of people with methylation issues have that kind of hyperactive, really hyperactive anxiety, you know, just running around crazy all the time, just feeling off balance. So that's something else to consider. So I've kind of gone through it of an overview, because I just wanted to give you an overview of all the different areas that it does affect, and areas that you need to consider looking at if you suffer from any of these symptoms. And I am going to actually go through this a little bit more, and I'm going to connect some more dots with MTHFR and other parts of the cycle. I just wanted to give you a bit of an overview today. So Florentina says, when I first take activated B, I do well for a week, and then I start getting anxiety again. That's why it's been hard to treat, because I read it. Okay, so what you need to do, Florentina, is you need to be really careful with the activated Bs that you're taking. So first of all, I would want to ensure that you are taking an activated form of B12. That would be your first thing. So you would want to get your B12 levels up before you actually start taking the B9, because some people do react to the B9 because it's pushing the system too much. So that's what I would first want to find out. Are you taking an activated form of B12, methyl B12? That would be my first question, Florentina, because that's very important, and that's where you would first want to start. You want to look, what's happening is, there's another part of the cycle for you, Florentina, that's not working. So we're going to have to talk about that next time, actually. So if it's histamine, what we would have to talk about with you is actually another part of the cycle. So maybe we'll do that and how it's related. So most likely your MTHFR, but another part of the methylation cycle needs to be treated. And I will try and think about which one that would be. That would be, I'll have a think about that. So it would most likely be maybe the MAO, that cycle. But that's why you're not getting. I tried methyl and hydroxy, and they still give me anxiety. Okay, so yes, Lisa, that's right. So Florentina, for you, it's about looking. So I think the obvious issue here is that one, it's the speed of methylation for you. Two, another part of your cycle, which is more important than MTHFR, hasn't been identified and needs to be treated. So we can do that in another Facebook Live. Definitely talk about another part of the cycle that influences histamine and why you would be getting anxiety. I would suggest that it's looking at the lower. If you have a look at this, if you can just go online and you can put methylation and look at the images. But if you look at the MAO pathway and the COMT pathway down here. Okay, so also you've got pyrols as well. So that's, yeah. So you've definitely then got some other methylation issues that need to be addressed before going the high dose with the activated Bs. Definitely. What you could do, Florentina, as a start, if you look, I would do, have you done the 23andMe DNA test? You could do the 23andMe, and then that would identify other issues with SNPs, other issues with DNA, with sequences that you might have. I would do that, because there's obviously an issue in the methylation pathway somewhere else that needs to be treated before treating the MTHFR. Also, another thing that can be happening is while you're taking the B vitamins, if they're speeding it up, part of the pathway is being missed as well. So I would definitely look at another part of the pathway, and maybe we'll cover that in another Facebook Live as it relates to histamine. We can do that. I can figure out as it relates to histamine. But I mean, what you want to do is you want to make sure that you're not having any folic acid. So these are things that people need to consider, especially with kids. All cereals, all breads, most of them have synthetic folic acid in. And what synthetic folic acid does, it actually binds to the receptor in your body, so you can't activate the folate, the folic acid, into the activated form for your body to use. So it's really important to make sure you're not having any cereals or breads with folic acid in. Florentina, you definitely need to remove gluten and dairy from your diet. That's very important, because that can cause issues as well with methylation. Those are the main two food groups I would remove. Make sure you've got your leafy greens. So you still want your natural forms. So your natural forms of your leafy greens, you still want to have those. Florentina, whenever you're taking any activated Bs, you want to make sure you've got low dose. The ones that are compounded are high dose. So you want to go low dose. I think let me double check. I think the Bioceuticals one doesn't have folic acid. A lot of them do have folic acid, but I think the Bioceuticals Multi-Care for Kids is activated Bs. But Florentina, what I advise from you is I would go very low dose. So I don't know, you're probably going too high dose. The compounding ones are really super high, and it's very common for people to react to those. You just want to go really, really super low. Even just the Metagenics, Metagen, that's not too high. One of those every couple of days, just to give your body a little bit of B12, a little bit of B6, but all the Bs. You need B2 as well. If you're just having B9, B6, and B12, then it's going to influence the other B vitamins, so you want to be careful there as well. So yeah, definitely look at the dose, Florentina. Go low dose. Always go low dose. Tread carefully, because the body, you know, it's got these pathways and it will do funny things. So just really tread carefully. So that's a B-Vits. And then also you can use the NAC, N-acetylcysteine. So what that does is it gets your glutathione up. The Metagenics has one called Metagen. It's a Metagen. It's like activated forms of B. Thorn do one, MTHFR, and Bioceuticals does one, but I don't know if it has the B12 in. You want to make sure that it's got a, you're getting your B2, your B12, your B9. Lisa, Metagen. Yeah, the Metagen one. And it's just, you can just go low dose. No need to go high. And then the NAC, which is the N-acetylcysteine, so that brings down homocysteine. Homocysteine is what damages the heart, it what damages the blood vessels, and causes a lot of inflammation in the body. So you want to bring that homocysteine down. With any methylation issues, homocysteine often goes high. I just wanted to make sure I hadn't missed anything out. So here's what could be going on with you, Florentina. I just couldn't think of it. You could have, if it's causing anxiety, you've most likely got low GABA. So you need to work on the GABA precursors first and the serotonin precursors. Work on those first. Very low dose activated Bs, and you need amino acids for those. So inositol, glutamine, BCAAs, tryptophan, all of those beautiful calming amino acids which actually help with inhibitory, like GABA. So, you know, you need to just calm that down. So you might have too much taurine, and so you might be feeding the taurine, and that causes that more hyper up. So you want to get more inhibitory, so work on those serotonin levels, those dopamine levels, and the GABA levels. And tryptophan is very, very good. Theanine is very good. So work on those to help with those specific inhibitory factors in your body. So I think that was the overview for today. And what that has kind of opened up, it's now opened up a discussion about taking the activated Bs and causing negative reactions, so other parts of the methylation. And it's opened up a few other questions, particularly about the histamine as well. So what that's opened up is those questions. So we will definitely I'm definitely going to actually focus a bit more on this and actually drill down a little bit more, because I can see there's some people that do have issues. Jacqueline, so the test, Jacqueline, I can organise that for you. The test can be done if you've got parents or if you've got anyone in your family. It can actually be done through Medicare, and you get it for free. That's if you've got a family history of it, or maybe your GP you can identify lots of symptoms, and maybe your GP can then order the test. The test is normally around $50. It can be done by a buccal swab, or it can be done by a blood test through labs such as Lavity, Douglas Hanley Moore, your GP, local labs like that. So the amino acids, you can just get those on iHerbs, Florentina. But definitely work on the tryptophan and the GABA, GABA precursors, definitely. So iHerb have those. Glutamine is nice. Glutamine is a nice precursor. And then just those amino acids. So gosh, that was a lot. So I don't know if that helped. That was a big overview, but hopefully it helped you. So what we're going to do is we're going to drill down a little bit more, I think, because there's a lot going on here, and how it's related to your health and how it can help you. So we will drill down a little bit more. We'll talk a little bit more about dopamine, serotonin, and GABA as well, and how they're related to the whole cycle. So I hope you found that helpful. Lisa, thanks for joining. Rachel, thank you. Florentina, thanks for all your questions. Thanks for joining. Jackie, thank you very much. I hope you all have a great day. If you've got any specific questions, please pop them in the thread. Feel free to pop them in the thread. I think I lost you. So Jackie, this will replay anyway. Once it's finished, I'm literally tying it up now. Once it's finished, you can watch the replay. So have a great day, everyone. And what are we today? We're Wednesday today. I'll be doing one tomorrow and Saturday. So maybe we'll talk about a bit more methylation tomorrow. Have a great day, everyone. Jackie, you can watch the replay once I sign off. Okay, bye.